Hello everyone, so today we are going to be looking at a new topic known as muscular dystrophy. And in the last video we talked about like I said, we are going to be dealing with musculoskeletal disorders now. And in the last video we talked about skeletal dysplasia, which is a genetic condition that affects the muscles and the bones and the cartilage. So today we're going to be looking at muscular dystrophy. And basically muscular dystrophy is also a group of genetic disorders, and here is caused by progressive muscle weakness and degeneration. Like the name implies, dystrophy means something that is breaking down. So is in simple terms is like muscle degeneration. So these conditions, they affect the muscle fibers, making them weaker over time, and this leads to difficulty in movements, like difficulty in walking, loss of function, and in severe cases it can lead to breathing or heart complications. So there are many types of this muscular dystrophy, each with different onset ages, like different time that they can come in different points of someone's life, different severity levels, and different affected muscle groups. So some can start in childhood, and others they can develop later in adulthood. So there's usually no permanent cure, but usually treatment like symptomatic treatment can help to improve the quality of life and delay the disease progression. So let's look at the background. So muscular dystrophy was first described in the 19th century, with Duchenne muscular dystrophy being the most well-known form as of that time. And scientists later discovered that the condition is caused by genetic mutations leading to defective muscle proteins, and this eventually leads to the muscle breakdown. So the disease has it has been extensively studied, leading to through genetic testing, and it has led to improved treatments and ongoing research into gene therapy. So this muscular dystrophy, it mainly affects the skeletal muscles, which are responsible for our movements, but some forms can also affect the heart and the respiratory muscles, making the disease potentially life-threatening. So that's what I meant by having some heart complications at the beginning. So let's look at the types of muscular dystrophy. So there are more than 30 types of muscular dystrophy, but the most common types are like the first one that I mentioned, which was dated back to 19th century where it was first discovered, Duchenne muscular dystrophy. And this is the most common and the severe form, and the symptoms appear in early childhood, between 2 to 6 years old. And affected individuals, they lose the ability to walk by the time they are teenagers. So that is basically how this type is. So the condition often affects the heart and the respiratory muscles, and it can lead to complications. Then we'll have the second type, known as Becker muscular dystrophy. So this Becker muscular dystrophy is similar to Duchenne muscular dystrophy, but is less severe, and symptoms appear later in life, like usually between adolescence and early adulthood. So this could be between, like, let's say 16 to like 20. So it could appear in between these ages. So individuals, they may retain the mobility for longer periods compared to where if they had Duchenne muscular dystrophy, which is the more severe form. Then another type we have is myotonic muscular dystrophy. So this is the most common type in adults. So it causes progressive muscle stiffness, weakness, and difficulty relaxing muscles after use. So it may also affect the heart, the eyes, and the endocrine system. Then we have, this is the fourth type, we have limb girdle muscular dystrophy. So this affects the shoulders and the hips first, before progressing to other muscles. So it can appear in adulthood or childhood with varying severity. Then the fifth type, we have fascioscapulohumeral muscular dystrophy. So this affects so it's not facioscapulohumeral. So basically the different types of this muscular dystrophy, basically the name is basically connected to the muscles that it affects. Like this is facioscapulohumeral, so it affects the affects the shoulders, the scapula, and the upper arms, the humerus. So that is basically the breakdown. So the symptoms usually appear in teenage years or early adulthood. Then we have the sixth type. This is known as congenital muscular dystrophy, present at birth or it develops in infancy. So some forms are severe and they cause intellectual disability, while others mainly affect movements. Then the final type, we have Emery-Dreifuss muscular dystrophy, which affects the upper arms, the lower legs, and the heart muscles. So this type, it can cause joint stiffness, and it can cause heart problems. So those are basically the common types of muscular dystrophy, although we have many other kinds, but these are the most common ones. So now we're going to look at the signs and symptoms. For the signs and symptoms, it varies depending on the type. So it varies depending on the type of muscular dystrophy, like we discussed. But the most common signs include, like, the early symptoms that you could see: delayed motor milestones, like delayed difficulty in sitting, standing, walking. So these are the early symptoms that you see. Then frequent falling or clumsiness. If you notice you are just always, you must hit somewhere where you are moving, you must. So frequent falls and clumsiness. Then muscle stiffness and cramps is also an early symptom. Then walking on your toes due to tight Achilles tendons. So this is also part of the early symptom. Then we have progressive symptoms, like, for example, gradual loss of muscle strength in the arms and in the legs. Then enlarged calf muscles, especially in the most severe form, Duchenne muscular dystrophy. Then weakness in the facial muscles, leading to difficulty closing the eyes or smiling. Then difficulty climbing stairs or getting up from the floor. And spinal deformities such as scoliosis due to the weakness of the muscles. So you find yourself bending over due to the deformity of the spinal cord. Then severe symptoms like breathing difficulties, like I said, is the major complication because of the weakness in the of the respiratory muscles. Then heart problems too, like irregular heartbeats, that's arrhythmia, and heart failure. Then sometimes difficulty swallowing to dysphagia, which may require you to use a feeding tube in the later stages where it becomes more complicated. So this is not really a mild condition. It's a very serious condition. And when we're looking at the clinical presentation, so the clinical presentation of muscular dystrophy depends on the type of the disease and the age of the onset. So in infants and children, the first noticeable signs are delayed movement, difficulty walking, and frequent falls. So that's the first noticeable signs in children and infants. Then in teenagers and adults, the condition may present as progressive muscle weakness, difficulty lifting objects, and muscle stiffness. Then in the later stages, individuals, they may experience respiratory failure, cardiac issues, and severe mobility limitations. that would often require them to use a wheelchair. So these are basically the clinical presentation based on the age and the stage of the disease. So when we're looking at etiology, that is the cause. So the muscular dystrophy, like I said before, is caused by genetic mutations that affect the muscle proteins, leading to progressive muscle damage. So the most commonly affected protein is dystrophin, and it is necessary for this dystrophin is necessary for muscle cell stability and function. So basically, this genetic mutation is affecting this particular muscle protein, and mutations in the gene responsible for dystrophin cause this Duchenne and Becker muscle dystrophy. So other forms of muscle dystrophy, they result from mutations in different genes, but mutations in this particular dystrophin is what causes that most severe form of muscular dystrophy. So with other muscular dystrophy, they result from mutations of other genes, and it affects various proteins involved in the muscle structure and function. So when we're looking at the risk factors, number one, family history of muscular dystrophy, then genetic mutations inherited from parents, like usually in an X-linked or autosomal pattern. Then for the male gender too, studies have found out that Duchenne and Becker muscular dystrophy is primarily more common in males, like it primarily affects males. So this type is primarily affects males. Then for the anatomy and physiology, generally muscles are made of muscle fibers that rely on structural proteins for movement and stability. So in muscle dystrophy, the affected proteins are either absent or non-functional, and this leads to muscle fiber breakdown and loss of function. So as the muscle cells die, they are replaced by fat and connective tissue, which further leads to the weakening of the muscles. So the breakdown is that muscles are made up of muscle fibers that rely on structural proteins. So when we have muscle dystrophy, these structural proteins are either absent or non-functional. So this is the genesis of the condition, and once these proteins are not there, these muscle fibers have nothing to rely on, and it makes them unstable and causes weakening. So that is just basically it. And for the pathophysiology, like I said before, genetic mutation leads to the defective muscle proteins. Then the muscle fibers become fragile and easily damaged, and inflammation occurs and fibrosis in the affected muscles. Then progressive muscle weakness happens due to ongoing muscle loss, and then there's severe disability, respiratory failure, and cardiac issues, which will develop in the advanced stages. Looking at the diagnosis, first, there's physical examination to assess the muscle weakness and the muscle reflexes. So check if how the patient reacts to like lifting certain objects, how they react to different, basically just checking how the different muscles are functioning. So we also do blood tests to measure the creatine kinase levels, which usually indicates muscle damage. Then genetic testing to confirm specific mutations. Then there's something called electromyography, which can evaluate the muscle function too. Then we can also do muscle biopsy to examine the muscle tissue for abnormalities. Then cardiac evaluation too for heart complications which can occur. So looking at the differential diagnosis, like I always explain, differential diagnosis is like other conditions that can mimic the same symptoms as the condition being treated. So conditions that can mimic this muscle dystrophy, we have spinal muscular atrophy, inflammatory muscle diseases, congenital myopathies, and motor neuron diseases. So it has a lot of similarities with other muscle conditions. Then for the management of this muscle dystrophy, or the approach considerations, medical treatments that we can use for symptomatic treatment to help the patient and to reduce disease progression, not to cure the disease, because there's no permanent cure for this. So corticosteroids, they could be given to slow the muscle degeneration, so they could reduce inflammation and they could just help the reduce the muscle degeneration. Then heart medications to manage cardiac complications that could occur could be given to. Then physical therapy like exercises to maintain mobility and prevent contractures. So we could also give braces and assistive devices for support, to support movement. Then for surgical treatments like surgery for scoliosis in severe cases, then tendon release procedures to improve movement. These are like the surgical interventions that could be done. Then supportive care can be given, like respiratory support in advanced cases where there's respiratory complications. Then nutritional support too in cases of dysphagia, where the patient has difficulty swallowing in the advanced stages. So these are just the supportive cares that can be given to. Then the prognosis. So milder forms of muscular dystrophy, they allow for a near to normal lifespan with some physical limitations. But when it comes to severe forms such as the chain muscular dystrophy, it significantly shortens lifespan due to the major complications that occur. So that is basically the breakdown of this genetic condition known as muscular dystrophy. Thank you.